In this video, we will see various pathways that have been investigated in various different disease conditions. And these are signaling pathways and their involvement in various health conditions. First one is RAGE-NF-B pathway. Is involved in neuroprotection by suppressing neuroinflammation and apoptosis. Activation of CJS STING pathway. It induces apoptosis. AMPK mediated signaling pathway extends the lifespan of C. elegans. AHK canonical pathway involved in antihypertensive strategies. Activation of AHR pathway in cancer. Regulation of WNT beta catenin signaling pathway in malignancy potential of cervical cancer. Activating WNT signal pathway in gastric carcinogenesis through upregulating TET. Furin NICD 10 pathway nasopharyngeal carcinoma cells. FOXO1 and WNT-B catenin signaling pathway protection against cerebral ischemia reperfusion injury. TLR4 MyD88 NF kappa B induction of and development of or induction of developmental and immune toxicity. Inactivation of WNT beta catenin signaling pathway. It inhibits the progression of lung adenocarcinoma by regulating DKK1. JNK pathway. It attenuates TNF alpha induced inflammatory response by ER stress activated JNK pathway. IGF-1 AKT signaling pathway is involved in skeletal muscle adaptation. PPARG NF kappa B signaling pathway is involved in attenuation of ventilator induced lung injury via anti-inflammatory and antioxidative stress. Immune signaling pathway genes involved in protection of leukocytes. FOXO1 pathway promotes autophagy and alleviates apoptosis. Multiple gut-brain pathway is involved in hypothalamic detection of macronutrients. PERK-CHOP signaling pathway, that is endoplasmic reticulin dependent pathway, it ameliorates nephrotoxicity. Hedhock pathway regulating HSC proliferation and epithelial mesenchymal transition. AMPK mTOR and NRF2 heme oxygenase 1 pathway is involved in activation of autophagy by attenuation of cadmium induced testicular impairment. PI3K AKT NRF2 pathway. It inhibits inflammation and apoptosis by attenuation of LPS induced acute kidney injury. SEPT7 AKT NF kappa B pathway. It promotes proliferation in glioma cells. Glucose fermentation pathway in biochemical system. Cholesterol biosynthesis pathway genes. Risk of prostate cancer. WNT beta catenin and JAK-STAT pathway. Then MAP kinase iNOS pathway in kidney necrosis by cadmium exposure. Kennedy pathways for membrane synthesis.